Hi guys, and welcome back to our channel. Again, this is Nurse Station by Diet Synergy and Professional Advancement Institute. And before we're going to start our second video, we just want to say thank you for those who subscribe to our channel, and also thank you for watching this video. Now let's start. This video is all about basic life support update. So it is again hosted by Diet Synergy and Professional Advancement Institute. Please do finish this video because in the last part there will be instructions as to how we are going to send the gift that we are going to give you because you are able to subscribe to this channel and you are able to finish the entire video. So our PRC accreditation number is 2017-123, valid until 2020. So let's start. Let's identify and know the difference between heart attack and a cardiac arrest. In a heart attack, blood flow to the heart is blocked. The problem is mostly on the circulation, while on your arrest, the problem is mostly on the electrical area or the electrical impulses wherein there is malfunction and the heart stops unexpectedly. Okay? For the manifestations, in a heart attack, there will be chest discomfort, shortness of breath, cold sweats, nausea, vomiting, and patient is unconscious. The patient is conscious for the heart attack. While for the arrest, the patient has no pulse, no breathing, and it is unresponsive and unconscious. Death may occur in a matter of minutes. That's why this is the focus of our topic for this day. It's the cardiac arrest and how we are going to help a cardiac arrest victim. So let's go to the next one. Okay, so CPR should start the time you suspect that the patient is in cardiac arrest. What to do? Let's review first the chain of survival for cardiac arrest victim. Okay, so the chain of survival includes calling 911. It's about calling the emergency hotline number, asking for help so that there will be an immediate personnel that will go or rush into that area, providing help to that cardiac arrest victim. Then as soon as you are able to call for help or 911, then it is also important for you to know your local emergency hotline number. Here in the Philippines, we have 911. Okay, so CPR must start after you call for help. Then for the other adult compression, it's going to be 30 compressions, 2 breaths if there is no pulse and no breathing. Then AED should be used immediately if there is available. And then this is one of the most important part. It's the emergency medical services. So by the time they arrive, it's either they stay and play or they just load the patient and go directly or rush the patient to the hospital. Then in the hospital, there will be an advanced care that will be provided or treatment if the patient after the code blue will survive. Okay, so breaking one of this chain will result into a lesser chance of survival of the patient. Okay, assessment. How are we going to assess the patient before we are going to provide care? So make sure it is safe by the time you approach the patient. Always make sure that you have a PPE with you or personal protective equipment, just like your gloves and your one-way valve or your CPR mask. 3 is ask for responsiveness if of the patient. So for you to check for the responsiveness of the patient, for adult, just simply tap the shoulder or just squeeze the shoulder of the patient and then ask, just stop and then ask if the patient is okay. For the infant, all you need to do is tap the foot of the infant and then look for any signs of consciousness, just like crying or there will be jerking movement or if the patient will move. Okay, now for number 4, check for pulse in the neck area, the carotid artery specifically. That's for the adult. And for the infant, it's going to be in the brachial area. Then check for breathing or chest movement. Then it is a must that after assessing the patient, you must provide compression or whatever the necessary management, just like your compression and also rescue breathing within 10 seconds. Now, also check if patient has pulse or breathing, or ask someone for help. Yeah, that's the first chain of survival. And then you need to get back to the patient as soon as possible, and then you're going to start doing chest compression at a rate of 100 to 120 compressions per minute. Okay. Now, for the chest compressions, allow chest recoil in each compressions. Compress enough, at least 2 inches in depth. And then hand position, you should locate the half of the lower half of the sternum. Place hand on top of the other hand on the lower sternum. So it doesn't matter if it's going to be your dominant or your non-dominant hand, as long as the proper location is on the half of the lower half of the sternum. And before, we are using the nipple line as our basis, so just below the nipple line. But then there are some people, especially for the old one, and also for the women, and also some of the person experiencing gynecomastia. So it is always safe that we're going to locate the half of the lower half of the sternum, and it's where you are going to provide your compression. Okay. And then begin compression cycle. So that's 30 compressions and 2 breaths. Now you need to push hard and push fast, and reassess the patient after 5 cycles. Check for pulse, and then continue compression and also rescue breathing if needed. Or when are you going to stop chest compression or the CPR? You will only stop compression or CPR if the patient has been revived, or if someone has take over, and also this person is able to do proper chest compression. And third, if you are too exhausted. So possible, guys, if you are too exhausted, is that you will also collapse. So make sure to just stay with the patient if you're too exhausted, and you can just keep on reassessing the patient, and then wait for help. You may perform compression only CPR or bystander CPR if you don't have a CPR mask for a face or a face shield, okay, with a one-way valve or a filter. Now, rescue breaths. After giving 30 compressions, make sure that you properly deliver 2 breaths using a CPR mask or using a CPR mask, or using a one-way face shield or a filter, or your face shield with a filter. Okay, so head tilt chin lift maneuver. That's how you're going to deliver your breaths. Then jaw thrust for patient with suspected cervical spine injury. For drowning patient, deliver first 2 rescue breaths before starting chest compressions, since this type of arrest is secondary cause of arrest, meaning it's a respiratory arrest that leads to a cardiac arrest. Now, for the rescue breaths, can also be given for patient with pulse but no breathing. So this is our second scenario for adult. The first scenario is has no pulse, the patient has no pulse and no breathing and unconscious. So that's when you are going to provide CPR or your cardiopulmonary resuscitation. And on the second scenario, the patient has pulse but no breathing, or if the patient has labored breathing, then just give 1 breath every 5 to 6 seconds for a total of 10 to 12 rescue breaths per minute. Reassess breathing every minute and pulse every 2 minutes. Okay, rescue breathing continued. If patient still has no breathing, continue giving rescue breaths until the patient has been revived or loses its pulse. If that case, provide CPR or cardiopulmonary resuscitation, and then it will be back to the first scenario. Recovery position: if the patient has pulse and breathing but unconscious, you still need to call for help and place the patient to recovery position to open up airway and drain possible secretions. Recovery position: flex the knee of the patient that is away from you, then flex the hand of the patient that is also away from you, and position it to the side close to you between the patient's head and shoulder. Now that will serve as a support of the head and neck of the patient on the side that is close to you. Then extend the arm close to you above the head of the patient. Then hold the hips of the and shoulder of the patient that is away from you. Then turn the patient towards you supported and continue assessing the patient until the EMS arrives, or you can also chart the pulse every 2 minutes. That is part of your assessment by the time you are still waiting for the emergency medical service providers. Okay. Now, this is the questions that you need to take note, because you need to send the answer to us to the email address that we will be providing on the last part of this video. Now, first question is what to do on the following scenario. If one patient has no pulse, no breathing, and unconscious, then the second scenario will be the patient has pulse, no breathing, and unconscious. The third scenario is with pulse, with breathing, but the patient is unconscious. Continue watching the video. Take note of your answers, because there will be more questions ahead. AED, let's talk about automated external defibrillator. It's designed it is easy and simple to operate. It has voice instructions for you to follow the time you use it. How to use? Simply turn on AED, use the power button, adhere pads to the chest of the patient. Pads has pictures for you to follow. Allow AED to analyze the rhythm. No one should touch the patient at this time. And then deliver shock as directed by the AED. Make sure that no one also touches the patient by the time you deliver the shock. If no shock is advised, the AED will instruct you to perform or to continue doing chest compressions. Now, facts about AED. Do not use AED if it is submerged in water, because it will not function. 2. AED can be used on pregnant women or women. 3. If patient has pacemaker, avoid it by placing pads at least 1 inch below or to the side. Just avoid placing the pads on top of the pacemaker. AED pads should only be removed the time your patient reaches the hospital or emergency department. AED pads are expensive and non-reusable. If you can find clippers, on the AED you can also find clippers and scissors, so that you can use it to trim if the patient chest is just too hairy that the pads won't adhere. Then some AEDs will deliver shock right after rhythm analysis. Do not touch the patient, and be careful always, and be familiar on the functions of your AED. Batteries and pads of an AED has expiration date, so please check on that always. AEDs can save lives, but it can also take away someone else's life during accidental shock. Delivery while someone is still touching the patient. D. Batteries and pads has an expiration date. AEDs can save lives, but it can also take away someone else's life during accidental shock. shock delivery while someone is still touching the patient. So please be careful. And then adult and PDI AED has different energy dose. For your question number 5, steps in using AED. So that's a total of 5 steps. And then again, save your answers and continue watching the video. Surprise is waiting for you. Take note of your answers. Infants and children. Most likely the cause of arrest is loss of breathing or due to an airway obstruction. It is a secondary type of arrest, and the chain of survival is different to the adult chain of survival. So let's discuss that one. The chain of survival for infant and children will start with prevention of airway and breathing emergencies. And 2 is early CPR with an emphasis on effective rescue breaths and, if needed, defibrillation without AED. It's defibrillation with AED. Prompt activation of 911, EMS care and transport, then effective post-cardiac arrest care in the hospital. So those are the 5 chains of survival for infant and children. Chest compression for infant, 1/3 or about 2 inches CPR cycle. Stop. Infant chest compression, depth is 1/3 or about 2 inches. CPR cycle, 1 responder to 30. If there's only 1 responder, that's 30 compressions to 2 breaths. If 2 responders, 15 compressions, and it is still 2 breaths. Please make sure to reassess every 5 cycles. For breathing, provide breaths, and then the baby should be in neutral position. Meaning you don't need to do head tilt or chin lift for infant. But if there is no visible chest rise, slightly tilt the head of the infant until you see a visible chest rise. Then include nose in delivering breaths. If you are using a face mask with one-way filter, use an appropriately sized CPR mask or bag valve mask. Cardiac arrest management for infant, scenario number 1, no pulse, no breathing, unconscious. Then this is the time that you're going to provide CPR or cardiopulmonary resuscitation. For the compression, 1 responder, use 2 fingers, the index and the middle finger, and then place on top of the sternum at the nipple line level. The rate will be still 100 to 120 compressions per minute, and the cycle is 30 compressions to 2 breaths. For 2 responder CPR, you can do thumb encircling chest and then place still on top on the sternum, and it's on the nipple line. Then the compression cycle is 15:2, and then there are some institutions who's going to inform you or to direct you to reassess patient after 10 cycles, since there are 2 responders, so that's 15:2 for 10 cycles, but it is not clearly emphasized on the guidelines. So this is the photo as to how you're going to do chest compressions for infant. That's the 2-finger method and also the thumb encircling chest. So on your left side, that's the 2-finger method, and then on your right side is the thumb encircling chest. Infant rescue breaths, scenario number 2. Infant has pulse, no breathing, unconscious. Provide rescue breaths, that's 1 breath every 3 to 5 seconds, and a total of 12 to 20 rescue breaths per minute. Reassess breathing every 1 minute. Reassess pulse every 2 minutes and provide CPR if needed. Infant, scenario number 3, it's all about recovery position. If the patient has pulse, has breathing, and unconscious, recovery position should be done. It's going to be a cradle face down position. Then you can also reassess pulse every 2 minutes. Then some institution may advise you to do burping position because it is simple and easy as a recovery position to be done. Then we have the last two questions. We have management for infant, no pulse, no breathing. And also for what's the management for infant that has pulse and no breathing. And the third one is, what if the patient or the infant has pulse, has breathing, but unconscious? The last question will be, what's the recovery position for infants? And this is the number 8 question, and this will serve as a bonus, so this will give you 10 points. What is the name of the training center? So make sure to answer the last question, the number 8 question. That's, what's the name of the training center? Now let's talk about special considerations. Motor vehicular accident. Do not perform CPR if massive chest damage or with severe bleeding. Warm patient with hypothermia, and also prioritize your care. So as much as possible, if there will be multiple casualties, then do proper triage. Number 4, for pregnant, provide support and then slightly turn the patient at a 30-degree angle to the left side. This is to improve blood flow going back into the heart.
Thank you for watching this video. Please like and subscribe. Email your answers to prccpd123@gmail.com with a copy of your PRC ID, and you will receive a gift from us. #CPD units. So don't forget to like, share, and subscribe, and hit the bell button for more videos. Please continue supporting us, guys. Daghang salamat.